for wrist taping, we are resisting or supporting is wrist flexion, extension, radial deviation, and ulnar deviation. This wrist taping that I'll be showing you is one through the hand. There are some athletes who will have support or just want some support, which is just at the wrist, and usually they'll just do a couple strips of pre-wrap and tape to help for that extra support. But this is if we have a wrist injury, a strain to those muscles. So patient position, they will be seated. You want them to have their hand nice and flexed and extended, not in a relaxed position, because if you were to tape in a relaxed position, then when they go to move it, it can be restrictive. So have them in that extended position. You will spray with Tough Skin, and then you're going to start about mid forearm with your pre-wrap. Go through the hand and end there. Then you're going to take your 1.5 inch white tape and you're going to go up the wrist. Again, you want to make sure that you're minimizing your wrinkles. Then when we get about to the top of the wrist, we want to go through the hand. So we're following, again, the pre-wrap, okay? We don't want to pinch the thumb webbing, so we're going to pinch our tape as we go through the hand and then come around the wrist. So we're basically making a figure 8. And end as so, okay? Now, if we just wanted some general support and we weren't resisting in a certain direction, we would clean it up and do it again. If we want to resist in a certain direction, say my patient has issues with flexion, we are going to put him in extension. So you'll have them turn their wrist and you're going to make a fan. So you're going to take 3 strips and you're going to fan it out with an X. Okay. You're going to put your athlete in slight extension because, again, we're resisting flexion. Okay. Mine's a little too long, but that's okay because you can fold it. And then you're going to secure it down with your wrist taping. Finish up with your figure 8. You'll check for capillary refill, make sure they can move their fingers, ask them how it feels, and that is how you would tape a wrist. Again, if we want to resist an extension, we'll put the fan on the palm side. If we want to resist an ulnar deviation, we'll put it on the radial side and just doing a few strips as it's a smaller area, and same if we're resisting in radial deviation.